If you're trying to study for the CHT exam, this video is for you. I share a tip on studying and I go over hand anatomy. So enjoy the video. Everyone who is coming in and you guys have been here, or you have been here for a little while, or you're coming in hard and heavy because you've been studying on your own and your exam date is May. We have 3 months. And so we have to really go at a very steady, focused pace for you guys to be ready for May. So there's a lot of new faces here that are actually here and want to take it in November. So even though it may seem like I'm like in your face, I'm really pushing, I'm going fast, always remember that you're just starting, you're picking up your cadence right now, and then but you don't have the stress of taking the exam, right? So just try and keep pace, and then as we slow down after the end of April, you'll be able to get everything that you're missing. So don't feel like you need to read everything. The whole point of this is to watch the videos, to listen to the replays, and then that way when you go to read, you already have certain concepts and it makes reading that much easier. All right. And then everything, there's some memorization, but obviously if we can understand a lot of concepts, then it makes the memorization that much easier. All right. And don't be shy. You can turn your cameras on. You don't have to be sitting and doing nothing but taking notes. I'm okay if you have the camera on and you're doing stuff and you're just listening. Having your camera on just allows me to see your face, lets me remember who you are. So when you send me questions or we get on private calls, I'm not confused. Who am I talking to? Because I'm seeing only blank names and not faces. So yeah, so it's not like a strict class where if you're eating, you're walking around, you got kids, whatever, it's fine. The key thing here is you're coming in, you're listening to a certain amount, and then you'll be able to capture as much information as possible, and then be able to listen to this call later. If you guys have any amount of driving, any downtime, it's a really good way to just listen and be able to observe and learn in different ways. All right. So I'm gonna stay pretty focused. All right, I'm gonna stay pretty focused. So you can send your questions honestly at any time. Michelle was just saying that she's never seen so many questions come in, even for new groups. So I welcome it. I think it's really great. One of the things I do is I section them out. So I section them out into whichever one. So if you have questions on tendons, I'm gonna wait until tendon. Obviously, hands and tendons are very closely related. And just about every hand case becomes a tendon case, and we're going to be able to merge that information soon. All right, but we'll cover hands and we'll cover wrists and we'll cover tendons, and we're just going to merge a lot of the information. Anything that's very, very nerve related, or shoulder related, or elbow related, or wrist, I want to keep those into their slots, so that we can all really stay focused and organized. Right, stay focused and organized. Now, I do welcome treatment questions. That's not a problem. It's completely off topic for our week, but you need help in the clinic with your patients, just, tell me, I need help, like urgent. Don't make me wait until the end of 2 months for you to answer my elbow question. I have an elbow patient right now. I'll be able to help you with the strategies and think through it so that you can take it from one session to the next session. Just let me know so I have the ability to better help you and give you responses in a timely manner for you. Okay, does that sound good? So yeah, awesome. So I'm gonna mute everybody. I'm gonna ask everyone to mute yourself. unless, if you want to talk, you can come on and ask me questions at any time. I'm just going to start my lecture, and then we're going to go and cover a lot of the questions that people sent. And really one of the biggest things is to be able to apply it. And tonight, I'm just going to really go into a lot of anatomy, and then we're just going to apply it. So what do you need to know about anatomy? One of the biggest things with the hands, right? So the hand includes the metacarpals, including the thumb, and then all the all the fingers. So what was I gonna say? So the articulations. So this is like really a lot of chapter 1 is just so, that's why I say people like get stuck in chapter 1. Like, don't read chapter 1 because you'll get stuck there. All right, so when it comes to the articulations of the hands and like the ligaments that go around, it's just important to understand what it looks like so that you can understand like how your hand really functions. I'm a big fan of drawing on the hand as well, and it just helps you to kind of keep things in mind. So somebody had a question on the arches. So the longitudinal arch goes from fingertip to palm, right? Because it's long. And then you have 2 transverse. So transverse just means across. So transverse is your distal transverse arch, right? It's distal because every time they think about anatomical position, it's every time they use words, they're always thinking of anatomical position. This is volar, this is dorsal, this is distal, and this is proximal, right? So you want to get used to understanding and breaking down the words in that way so that it makes it easier for you to go through questions, or makes it easier for you to understand when you're seeing those words when you're reading. It's helpful, right? So the longitudinal is just long, right? And then you have your transverse. Your transverse is your across, right? And your across, you have 2 of them. You have a distal one, and then you have a proximal one, right? So if you think about what they do, they allow you to be able to cup your hands, right? From a functional standpoint. Now, also understanding your distal transverse, it crosses all the metacarpal heads, and the metacarpal heads have only a little bit of movement. They don't have that much movement, right? If you feel them, have to be a little bit of space in between your metacarpal heads, but they don't have a ton of movement. Now down here in the proximal transverse arch across the MP, so across the proximal metacarpals and the wrists, it goes across all the metacarpal bases and positions them even tighter. So if these metacarpals don't have any room, imagine these barely have any room either. But they have the most amount of room on the small finger, on that ulnar side, and on the thumb side. That's where you have majority of your movements at the base of the metacarpal, right? So if you think about it, think about all the injuries that could happen in that area and why you would have to treat it the way you treat it, right? So I'm going to give you an example. If you understand that and you have a fracture of your 5th metacarpal, right? Whether it's at the base, in the middle, or in the distal end, how would you treat it? So anything around here, shaft, like the middle to the proximal end, you're gonna need to immobilize, right? And you have to immobilize the wrist because that metacarpal has a lot more movement than, say, the first one, right? The metacarpal, the second, and the third metacarpal are your largest metacarpals, right? So when you start studying it, don't get bogged down with knowing all the shapes of the metacarpal head and like the base and all that good stuff. Just know the most important, right? The metacarpal base by the wrist has articular surfaces that can articulate better with the carpals because they're all so scrunched together. And when we get into the wrist, you'll understand that that gives the wrist a certain amount of stability, right? The second and third metacarpal are the largest, and it's unique because it has a sideloid bump that allows you, again, those are the largest. So when you are putting weight bearing through the wrist, these two metacarpals take the brunt of the weight bearing pressures at the wrist and at the hand. These are also your sites for your extensor carpi brevis, your wrist extensor. And then of course we all know that the thumb, the base of it is very different, which creates your CMC. And it only articulates with the trapezium, that metacarpal, right? Your first metacarpal articulates with the trapezium, and it rotates more than any of the other metacarpals. It has the most amount of movement. And the reason why it has a lot of movement is because it has a concave and convex surface. So all that just means is it's in one direction here, and then it's another direction here. So some of the words that are important to kind of recognize with them is that with the concave surface oriented medial to lateral, that's your sagittal plane. And the convex is anterior to posterior. So anterior to posterior, that's your coronal plane. And then your medial to lateral is your sagittal, that's your concave surface, right? So it's not that you have to know everything, it's just that certain ones, like, you want to just be really familiar with the terminology and the words that they use. You want to understand it simply so that you can then understand it complex. So when you're in the test, you can do both, and you won't be thrown off by some of these words that we don't necessarily use in the clinic. If you're a therapist and you are struggling to study for the CHT exam, check the link below. It's the exam on demand. There's a way to study easier, better, and faster, and don't deny yourself the help. Check out the link below.